One of the commonest questions I get asked in clinic when I see patients is what is the difference between a Ministernotomy aortic valve procedure and a Minithoracotomy aortic valve procedure? Well, before I explain those two procedures, let me go one step back and talk about the traditional way that we operate on the aorta or the aortic valve. The usual way to do that is through what's called a median sternotomy. It's a full breastbone break. We divide the breastbone using a controlled saw, and we can do pretty much anything to the heart through that approach. And we can certainly replace or repair the aortic valve. Now, the problem with the median sternotomy is it's a big cut. It takes 12 weeks to heal. It doesn't hurt a great deal, but it does. There's a little bit of instability there, so you have to watch the way you sleep and the things you do for the first 12 weeks after the surgery. That's a really significant period of time. Fortunately, many surgeons now are able to perform aortic valve surgery through what's called a mini sternotomy. This is a way to do the surgery without breaking the whole breastbone, but just breaking the upper third of the breastbone. And what this allows the surgeon to do is leave most of your breastbone intact, and this reduces the risk of infection, the risk of bleeding, and certainly it hurts a lot less. Patients can breathe a lot easier after a mini sternotomy. Now, the problem with a mini sternotomy is it still takes 12 weeks to heal. Now, some surgeons, like the surgeons at the Keyhole Heart Clinic, perform aortic valve replacement and repair surgery through a minithoracotomy, a little cut between the ribs on the right hand side. Now, the big difference between the minithoracotomy and the mini sternotomy is that with the minithoracotomy there is no broken bone, and this means that the wound or the incision can heal in 7 or 8 days, and that's really very, very attractive in terms of getting patients back to all the things they like to do so much quicker. Now listen, be in no doubt, whether you have the full sternotomy or a mini sternotomy or a minithoracotomy, heart surgery will leave you feeling tired. But of course, if your incisions are healing in 7 or 8 days, you can see how much quicker you're going to recover. Now, not everyone's suitable for minithoracotomy. The most important feature is, of course, that your surgical team, and I mean team, not just the surgeon, but the anaesthetist and the rest of the team around him or her, have to be experienced with minithoracotomy AVR. The other thing we need to ensure is that there are no other contraindications to this particular approach. In order to assess you, we would check your echocardiogram to make sure that the diagnosis of aortic valve disease is correct. We do an angiogram if you've not already had one done to make sure your heart arteries are healthy. And then in addition to all of that, we would do a CT scan of the aorta to assess the suitability for us to place micropipes in the groin. This allows us to do the minithoracotomy aortic valve replacement without spreading the ribs or cutting any bones, and this is really why this incision is so attractive, because it then allows us to reduce your pain significantly, reduce the risk of infection and bleeding significantly, and also the rate of wound healing is a matter of days rather than weeks.